saying this so people are aware that it is something that's being recorded. Our annual report is available online on the Trust website. If you follow the links through to the annual general meeting, you will find it. And we'll have the annual report, the accounts and the minutes from the 2021 AGM are all there. They need to be formally approved and we will formally approve them in a few minutes. Please make sure your computer's on mute for now, but you can feel free to post questions in the chat if you have something that you want to get through to us, and we can address those in the Q&A session at the end. Any questions not addressed today, we will obviously ensure that they can be addressed at a later date by the appropriate person who can tell you the right answers. And the link for that is on here. Ooh.
You just close the right-hand box, please. Sorry.
Right.
Technical issues.
Small technical. Okay, that's brilliant. Thank you. Okay, AGMs are always formal events, and so we will go through the formalities that we need to go through for this. So in the first instance, I will ask whether there are any declarations of conflicts of interest for board members in relation to this particular meeting. If you can, either put it in the chat or raise your hand if there is. No hands going up, so I'm presuming there are no declarations of conflicts of interest. Okay, our next task is to agree the minutes of our previous AGM, which was held virtually on the 22nd of July 2021. Could I also have a show of hands now from my fellow board members and anyone else at that meeting to agree those minutes and to tell me if they're happy with those minutes. If you could put your contact hand up. Okay, I'm getting thumbs ups instead. Thumbs up. Thumbs, lots of thumbs. Okay, right. We will accept the minutes of the 2021 AGM. Thank you. And finally, we need to formally adopt the Trust's annual report and accounts for 2020 and 2020 to 2021. Can I also ask fellow board members to agree those, please? Same way. Brilliant. Okay. Thank you. Lots of thumbs. Everybody happy? Great. Thank you very much. So, as a trust, we have a vision that we can deliver outstanding services, and in doing so, and ideally in partnership with our very important partners in the system, we will help to deliver healthier communities in this area. We have, I think, excellent values. I can be quite silly about them sometimes, because at one stage when we agreed these values, the staff were actually quite concerned that we put caring in second and not first, because caring is so important to our staff, and it was all about the initials. We didn't want to be the CIA. But very important values that we've got, to be innovative, to be caring and to be agile. Values that have been tested so much in the past couple of years during this pandemic, and will continue to be tested as we move forward in the new system that has come about in recent times across Hertfordshire and West Essex. We are a provider of community-based healthcare services across Hertfordshire and beyond. We provide school-aged immunisations across East Anglia as well as Hertfordshire, so we've got quite a wide expanse of reach in terms of our school-aged immunisation services, but we also provide a huge number of services within Hertfordshire itself and a little bit further afield. As a trust, we were rated good by the Care Quality Commission. Just at the start of the pandemic, we had our updated rating of good. And they've continued to keep in touch with us at regular intervals and to review our trust, but there's been no suggestion we have anything other than good, which is fantastic, although we have aspirations. We provide 48 different clinical services for adults, children and young people, and that doesn't include the COVID mass vaccination service, which, as many people will know, has been an amazing service that we have been delivering for 18 months or so now, a bit beyond, a bit more than 18 months now, and that we stood up extremely quickly at the time. So we are very proud of that service, but we're also very proud of all the other services. We work in partnership with organisations across the NHS, with social care, with local authorities, with the community and voluntary sector, and they are very important partners to us, and we will be building more on that as we move forward in the new system. Our strategic objectives guide what our activities are. And I think I'm not going to go into great detail on those, because I think Elliot is going to go into more detail on all the strategic objectives and how they guide our activities within the Trust. But we do find that our staff are very aware of our values, our vision, our strategic objectives, and actually work to them. So I will now hand over to Elliot, who will talk to you at this stage. Elliot.
Great, thank you. And thank you, Linda, and thank you and welcome to everybody that's joined us today to review the 21-22 year for HCT. It always feels slightly strange doing these events because so much moves on even in the few months that have happened since the end of the year. But this is to formally review last year, so I'm going to talk a bit about where we go next, but also a bit about what's happened. As Linda said, I think actually focusing on the healthier communities and focusing on our vision and our values and our strategic objectives. Even as we've gone through the pandemic, that circle in the centre, I think really matches what we do as an organisation. So I always use it in talking about the organisation, talking about what the organisation is trying to achieve, because I think actually it describes it really well. Linda mentioned about whether caring should be first or second. I always think about the agile and the conversation that we had about agile, and I think if there's anything that we've learned over the last 18 months since I've been here, that agile is not only a requirement, but also people have developed an enthusiasm for being agile, which I think is beyond what needs to happen, but I think also makes us feel slightly more relaxed as an organisation about trying to do something different, trying to innovate, trying to be agile, trying to respond to what in a pandemic world and a post-pandemic world is a massively changing environment in terms of the healthcare that we have to deliver. So I think it's important that actually the vision and the values and the strategic objectives of the organisation match. Actually, if you listen to people out throughout the organisation, what they talk about matches very well to each of these areas. I'll come back to them, but also just to briefly talk about them for now. Outstanding quality and performance is about primarily recovering services and making sure that the performance of the services are where they need to be, that we see people quickly, we see the right people, and we aim as an organisation to see as many people as possible. But it's also about making sure that we are high quality and the high quality of those services at all times. That we innovate, we do things differently, we make the changes that we need to. And hopefully through all of that, and through our dialogue with staff and our effective dialogue with staff, which I'll come back to in terms of being a great place to work, hopefully the CQC will recognise us as an outstanding organisation as a result of that activity, not because we are primarily focused on getting a badge of outstanding from the CQC. Joined up local care, I think HCT and community services in general have a pivotal role to play in terms of the coordination of health and social care services across the community, linking in with social care, with education, with the mental health trust, with mental health services, and also with the acute trusts to make sure that patients receive services that are coordinated, integrated, and makes sense from a pathway point of view for children and young people and their families, but also for adults in the latter stages of life as well. We are committed to being a great place to work. We are committed to having a dialogue across the organisation that is open, honest, challenging of us as an executive about what we are doing within the organisation and where resources are needed within the organisation, and us as an executive fighting for the resources that we need across the system in order to make the services as responsive as possible. And best value through innovation, making sure that we adopt modern processes, systems, technology, and we're efficient as possible in order to deliver the services in its efficiency for the of making sure that we can expand our reach to as many people as possible and provide those services to as many people as possible. So if we move on to the underneath that, there are strategic outcomes that are supporting that on the next slide. I just wanted to pick up a couple of things that we're particularly proud of in terms of that. Our staff survey results, which I'll come back to later on, and how we not only within community trusts that generally score higher in terms of staff survey, but even within that, we have outstanding results on the staff survey. We are the 7th highest trust in the country for freedom to speak up, and we have an aspiration to provide outstanding services, as I've talked about. I think that's all about honesty, about challenging us from the services, about what we need to change within those services, about the openness and the agility of those to meet the new in developing solutions to meet those challenges, and then having a collective agreement as an organisation across the organisation about how we're going to enact the plan that we agreed in order to improve those services. I think that open dialogue with staff is really important. We constantly invite and welcome challenge from across the organisation about where we need to do things differently. So some overview of what we've been doing next in terms of some highlights as well. The slides will catch up in a second. HCT services, we've recovered, and we have recovered from quite an early stage around to getting services back to pre-pandemic levels. That means, and there's some highlights on here, that we see about 50,000 patients a month. That's an extraordinary number of appointments to do. For those that work in more formal healthcare settings, and we're out in people's houses and in small clinics locally to people all the time, to deliver 50,000 appointments per month would need about 138 clinic rooms if you were sitting in an acute trust. I don't know of many acute trusts that sit there with 138 outpatient clinic rooms to do it. So just to give you a scale of the size of that, I think our part of our challenge is that we do a lot of that invisibly because we do it out in people's homes rather than in a large building. But I think that's really important in terms of supporting people where they are in the community. We do it, as I said, in collaboration with system partners, with social care, with the acute hospital, and also with mental health. And as I've said already, it's important that we do the right business, but we do it in the right way in terms of our attitude within the organisation. Moving on then, ongoing response to the pandemic, and the second one, despite COVID-19, we delivered a lot. But it's worth saying in both of those first two that we did a massive programme on vaccination, but that also required the organisation to pivot quite significantly around what we did. It required, during the pandemic as well, us to redeploy staff significantly across services. We did much less of that in 21-22 than we did in the year before, and that was in response to staff saying that they wanted to try and keep their services running because they were worried about the waiting times effect on their services. I said when I first arrived at the beginning of just before April 21 that we would face a really difficult point at some point where we're trying to run a vaccination programme, where we're trying to recover staff, and where we were trying to support the community with COVID work. We felt that at times, I think during 21, 22, we felt it very acutely in terms of the exhaustion of staff trying to do all those three things at the same time. I think it was the right thing to do. I think it put our staff under a lot of pressure, and I think our staff responded brilliantly to that, one and all, in terms of whether they were staying with their service or whether they were redeployed. But it was the right thing to do, although at times people wonder whether it was in the depths of winter, trying to respond to all of those things. But it meant that we've come out of that with less to recover than we would have had otherwise, and I think that's really important. But it is worth saying about the vaccination programme particularly. 17 vaccination centres set up and established within 4 months for the most part, delivering 1.8 million vaccinations. So a huge effort to do that, and also vaccinating pupils in mainstream and specialist schools across East of England, which is 650,000 children. At the same time that we took over as a result of a successful tender, the school age immunisations programme across East Anglia. The same week that we took that over, we also went live with COVID vaccinations across schools across the East of England as well. So massive challenges in terms of trying to do that at the same time. In terms of ongoing response to the COVID pandemic, I'll come on to some specifics in a minute, but I think we've all learned some valuable lessons across health services about the way services can work, and the way services should work perhaps in the future. Services don't need to take years to be set up, and don't need to have exhaustive processes in order to evolve rapidly to meet the changing demands. We can do that much quicker, and I think it comes back to the agility point again of saying, actually, if we have set up something and we need to change it, we should be bold and change that quickly and change it with partners. And actually, the COVID pandemic has told us that we can do that if we are clear about the purpose of that, which is the second point. We had a much more dynamic approach to risk, and we instituted something within the trust, which is still running, which for those of you familiar travelling in and out of London, the tube lines running map was all our services, and then whether they are running fully, whether they're partly suspended, whether they're fully suspended at any point, and that allows us to dynamically manage where we put resources within the organisation and how we manage that. And we use that through our bronze group in order to make sure that we can redeploy staff flexibly as we need to, as we go through and manage that risk. So alongside the COVID, I've talked about it in a different way, but 1 million contacts with patients, 34,000 people that we see every month in their homes is through the ICTs, the integrated care teams. Other teams see numbers on top of that as well, but that is the core of the district nursing and district therapy service. That means that those 34,000 people have already been seen by a healthcare professional. We are supporting them at home, we are supporting to help keep them at home through that service, and otherwise they would be calling an ambulance and going into hospital. For the most part, they are for the most part quite seriously ill and quite seriously compromised in terms of their health. And without that sort of support from those teams, they would be called into hospital quite quickly. We had an income of 153, which David will come on to talk about more later on, which was significantly up from the previous year, and we had more staff, which reflected the fact that we did more work and had more income. So growing through the pandemic, rightly so, in terms of our response across the organisation. I won't spend a lot of time on each of these, but it's worth saying that the hospital at home service was working in collaboration with the East and North Trust, the commissioners, the local authority, primary care, both in terms of admission avoidance significantly to keep people at home, but also to get people out of hospital as quickly as possible. So prevention of admission, but also remote monitoring to support people at home, so-called virtual wards. But I think the whole work around that is integrated for us in hospital, at home. We are committed to being cheerleaders, champions, irritants for children and young people and the services that they need across the system. We perform all, sometimes all at the same time, in meetings that I go to, and I think it's really important that children and young people and their services get a voice in recovery from the pandemic. And I think we're very lucky to have the ICB and the people within the ICB that we do who support us in that and in that those services. We've done more and more CAMHS partnership working. We work closely with HPFT to manage referrals, to make sure that cases are complex cases are triaged and get to the right place, and that children and young people find their way to the right place. And it's not too much of a struggle, which probably brings me on to the Children's Integrated Care Coordinators, which was a pilot that we set up to manage children with complex needs, to make sure that those children and their families, who could have up to 21 different health professionals involved in their care, received a much more coordinated and integrated service. And we've done further work with Barnardo's, HCT and us and the Acute Trust to work in the ED to make sure that we can provide alternatives to admission for children as well. We think that, particularly in the area of children, that actually working with the voluntary sector is particularly important. And we have been very clear about trying to work with ADS and various other advanced practitioners to deliver episodes of care to children in school. We think we can work further with the voluntary sector to deliver more and more of that children and young people work in partnership with them. Moving on, lots of developments in adult services. I'll pick out three. The electronic prescribing awards, which was probably long overdue, but is now in place and effective in terms of reducing prescribing issues. The long COVID service, which is recognised as a national front runner and has advised, I think, certainly the Scottish Government, but I think also the Welsh Government as well, in terms of its service and how to set up long COVID services. And the frailty clinics, which are heavily integrated with primary and secondary care frailty services, to make sure that we support a really frail and needy section of the population. On children's services, the Chat Health was set up by the school nurses, fabulous engagement with children across schools in Hertfordshire, set up entirely by the school nurse on their own. We heard about it after they'd done it, which was fabulous to hear, because it means that people feel free and able to innovate and set up services on their own without us having to know about it first. So we're really particularly pleased about that one. We had an integrated therapy assessment, so we see children once again coming back to that theme of integrating services. And self-booking for speech and language first appointment is a really simple thing, but actually allowing people to choose when and where they see people, rather than forcing that upon them and then for people to struggle to make those appointments. And the Children's Services Coordinator, I've already mentioned. Within corporate services, we haven't stopped there either, and it feels like that at times. We in 2020-21, we revised our corporate strategy and finalised that. In this year, we have focused on clinical quality strategy and the green plan. The clinical and quality strategy was a brilliant bit of work delivered by Elizabeth and Adam Levy, who's in our strategy team, and was particularly notable for the way in which it had engagement across the whole health economy. We didn't sit in a darkened room and write this strategy. We delivered it. We wrote it with everybody else, and it has 5 really clear priorities within it. One is to integrate care. Secondly, is to improve physical and mental health outcomes. The third, around personalised care closer to home. Fourth, about reducing health inequalities. And the fifth is unusual for a clinical quality strategy, but I think is really important, which is supporting and growing our people. We didn't believe that should sit solely within a people strategy. We felt that in order to deliver high quality services, we needed to support people to deliver that in terms of their attitude to service development, how they approach that, how they could approach that in a quality improvement way. And actually then it had every place within a clinical quality strategy to make sure that people were supported, encouraged, and effected really significant change. So we're really pleased about that. We're really pleased about the green plan that we've rolled out. We have a net zero roadmap to reach our goal of being a carbon neutral organisation. We've established a really key network of green champions across the organisation. We have done a lot of work with strengthening inclusion, and also perhaps significantly realise that as a trust we need to listen much more to voices that we have previously, perhaps as a society, but also as an organisation and as the NHS, have previously ignored or not listened hard enough for. Are certainly growing out of Black Lives Matter, but also other movements as well, people from diverse backgrounds, people from Black backgrounds, Asian and other backgrounds who work within our trust who don't feel that they have the same voice, feel they have the same strength of voice. We need to listen harder to those groups. We need to listen harder across LGBTQ+ groups and disability as well. We're really committed to this, and I think it's really important that we have that real strength of listening. I genuinely don't think it's about people speaking up louder and having to shout louder. I think it's about us trying to listen better, to hear those voices. That comes through in terms of some of the policies that we've got around transgender, and particularly important about menopause as well, and supporting people, women through menopause when they're working within our services. If we move on again, I think I've covered most of this in terms of the redeployment of recovery of services, the redeployment of staff, making sure that we've dealt with notable pressures in children's therapies, community paediatrics, CAMS, integrated care teams. I always frighten the integrated care teams by going out and saying that I want them to do more work, which I do because I think we can support more and more people in their homes, but we need more resource in order to do that. So the more work comes with more resource, and we again are committed to making sure that we invest in those services in order to reach as many people as possible. If I move on again, Great Place to work is central to what we need as an organisation, which is why it's within the clinical quality strategy. We're proud to have been awarded a Bronze Award for the Armed Services or Armed Forces Covenant, but we are equally proud to be a disability confident employer. Our freedom to speak up at number 7. Best trust nationally, we are particularly proud of. We'd obviously like to be number 1, but that's for next year. And also in terms of our staff survey and the real benefit and the real good feedback that has given us, both in terms of saying that we're doing the right things, but also where we need to focus on going next. If I move on to key recognitions for staff. Now, I'm at this point unashamedly going to read from a list because I can't remember all the detail of all of the awards, but I think it is really important that we recognise where we have been recognised externally. So we put through 100 entrants, put forward posters for the HSJ Patient Safety poster campaign, which recognised safety and quality improvement initiatives. We did one in partnership with Eastern North Hearts Trust to support early service for people with COVID-19. And we're delighted on that to have won the response to COVID-19 category. As a result of the work on the vaccination programme, Kath Slater, our Deputy Director of Nursing, was awarded Super Purple Star registration or recognition certificate. First ever individual to win that award for making reasonable adjustments and going the extra mile in making reasonable adjustments. So I guess that would be making extraordinary adjustments and overcoming barriers to deliver vaccination to our communities. Our Director of Nursing, Sarah Brown, was awarded the Queen's Nursing Award in November 21, along with Kath again, Rebecca Harlow and Angela Peck. HCC was shortlisted for two British Medical Journal General Practice Awards. Dr. Harsha Masters was shortlisted in the GP of the Year award category for the work on long COVID, which I previously mentioned, and Medical Director Elizabeth Kendrick and the Prevention of Admission team was shortlisted for the GP Team of the Year award. Trust also really won highly commended in the NDL Software Community Awards 2021, which celebrate excellence and project achievements of that community. The Driving Value Award was the development of an e-consent form by the CHIS team, Child Health Information Service team. I'll go on because I think it's important to. In June 2021, the Trust was awarded the Stars in the Sky Award for the work of the Lymphedema, Leg Ulcer and Tissue Viability Service during the pandemic, and were awarded an extra Bright Stars prize as a way of saying thank you for all the work that they had done through that service. The Trust has been awarded Purple Star certificate by Hertfordshire County Council, recognition of COVID immunisation programme and bridging the health inequality gap for people with learning disabilities. And the St Albans Children's Centre was recognised at the beginning of the 2021 Better Building Awards, winning highly commended in the category for refurbishment projects. I think it's really important because these awards and the excellence that they demonstrate in our services are really important to us and really important to the way in which we work as an organisation. We aim to be an inclusive, open, high quality organisation that can reach as many people as possible across Hertfordshire and deliver as much healthcare benefit to them. Again, coming back to the circle at the start in terms of the values and the aspirations of the organisation and the strategic objectives are really close fit with all of that. Which is why I'm going to end there in terms of talking about the strategic objectives again and where we go next. High quality services, we need to continue to recover our services to pre-pandemic levels. We need to be really focused about achieving good to outstanding, and the list just read out is key to how we do that and how we develop those services. The joined up local care, we need to continue to work across the system to make sure that services are more integrated and feel more integrated to children, adults, older adults, frail, across the spectrum in terms of how the health service delivers care in a much more integrated way to those patients. We will continue to challenge ourselves to deliver best value through innovation to make sure that we are adopting the most modern of processes, both management processes and in terms of technology as well, but also in terms of transformation. how we transform our integrated care teams to see more people, to support more people at home, how we work with the ambulance service to support more people at home, how we reduce children's weights, and how we change some of the services that we run in normal ways, if I can say that, around community dental, leg ulcer and others, to make sure that they meet the needs of patients as we go through. Lastly, I'm going to end on all of this by a thank you to our staff. I've said partway through the presentation that it felt uncomfortable at times in terms of all of the things that we were trying to do at the same time in terms of COVID response, keeping normal services going and doing the vaccination programme. We felt it, our staff felt it, we felt the pain from the organisation at various different points, but we also felt the support for trying to do that and for the aspiration of trying to do that. So I'm immensely grateful to our staff for what they've done, the dedication to each other, their support of each other, and the dedication to their patients and the communities that they serve. So I'll end on that. Thank you. Hand over to David, who's going to take us through the financial report for 21-22.
Thank you, Elliot. So yes, as it says on the screen, David Baker, Director of Finance. So very much like the 2021 financial year, the 21-22 financial year was one of emergency COVID response arrangements in terms of financing. That meant we had no formal contracts between commissioners and providers where we were providing NHS commissioned activity. And providers predominantly received block payments that provided the funding to maintain those services in response to the COVID pandemic. In terms of the mass COVID vaccination programme, that was funded on a reimbursement basis. That meant that each month we reported on the additional expenditure that we'd incurred to deliver that programme, and we received a retrospective reimbursement of that expenditure. And I've put at the bottom of this first slide system envelopes. We started to see in the 2021 financial year system envelopes being allocated for capital, and that's continued, and that means that we have to discuss and agree locally with what is now the Hertfordshire Essex ICB and with other providers about how the capital available for the system is distributed. And for the second half, particularly of the 21-22 year, the system had a funding envelope for the revenue costs. So although there were no formal contracts, we still did have to enter into an element of negotiation with the system about securing that funding. If we go on to the next slide, so there's just a few sort of pieces of information there about the impact of COVID on our finances. Direct COVID-related expenditure at 27.9 million. The primary component of that was the expenditure and associated income associated with the vaccination programme. Last year I drew to everyone's attention the impact of COVID on untaken annual leave. And you can see that between 1920 and 2021, it jumped significantly from 0.1 million to 1.2 million. And at the end of March 22, it's increased slightly over and above that value again, up to 1.3 million. And the other bit of information that I thought was quite interesting was the amount of personal protective equipment we received from the Department of Health and Social Care's central procurement team. This had no direct cost to HCT. It was provided effectively free of charge at point of usage, but we incorporated the gross values into our accounts in terms of reflecting additional income and matching it with spend. 2021, we had 5.4 million items, and that had a value of 1.4 million. In 21-22, the number of items reduced to 4 million, but the cost reduced significantly to 0.2 million. Reflecting, I think, the impact of sort of basic economics on supply and demand for PPE in the 2021 year. For example, examination gloves in June 2020 was 16p each. By March 22, they'd gone to 3p each. So a significant reduction in the cost associated with that. If I go on to the next slide. So the headline in terms of the accounts, our turnover at 153 million. We had a financial outturn, a surplus of just under 1 million. Our staff costs at 109 million, and that included agency costs of 3.9 and bank costs of 4.7. Our capital expenditure was 7.4, and that's split broadly into estates, and I've included medical devices in that value this year because a lot of the work we did on estates was about whole building refurbishments, and the medical devices became a subset of those projects at 5.3 million. IT equipment and infrastructure at 1.4 million, and environmental and energy improvement investments of 0.7 of a million. And that includes things like the implementation of LED lighting in sites and other areas of environmental improvement. Our cash balances were 27.5 million. That's a reduction from the balances we had at the start of the year, but those reductions were known due to things like the changing basis for the mass vaccination programme reimbursement and a couple of technical issues associated with the and the move into the emergency funding arrangements. In terms of our statutory duties, so I've put this table together. There are a variety of statutory duties, and I've cross-referenced them to the note in the accounts, which is part of the annual report and accounts pack that was approved earlier. We achieved at least a break-even position. This is the 12th consecutive year that the Trust has achieved a break-even or better financial position. Our underspend of 1.3 million is adjusted down to reflect an asset disposal to the 958,000. We stayed within our capital resource limit. We didn't exceed an external finance limit we had. We achieved a capital absorption rate of 3.5%, which is part of the statement of comprehensive income, which is on page 123 of the annual report. In terms of the Better Payment Practice Code, we do have a bit of work to do on that. Our performance is not at the 95%. That's been recognised, and we are undertaking work during this financial year to improve that. In terms of the auditors issued a full audit report on the 28th of June. I won't read the detail of that slide out, but the first bullet is probably the most important, confirming that our accounts represent a true and fair view of the financial position of the Trust. And the only outstanding bit of audit-related work on the next slide is the value for money report that they have to do. The timetable for that is that work needs to be completed by end of August and then formally submitted by 22nd of September. But you'll see in the last paragraph of that slide that the auditors are satisfied that that work will not have a material effect on our opinion on the financial statements for the year. And that, I think, is a summary of the financial position and the financial highlights. So I'll hand you back to Linda.
Thank you, David, and thank you, Elliot. I think anyone can see why at the very start of this I said I'm very, very proud to be chair of this trust. We've heard lots from both Elliot and David that confirms why anyone would be proud to be involved with this trust. There's now an opportunity for you to ask questions. Two ways to do that. You can either put a question into the chat function of Teams, which some people have put comments in there. I don't know if there's any questions in there yet because I can't see it. But in addition to that, there is the ability to use the raise your hands function and unmute your mic and actually ask a question directly. So if we can't answer it today, if this, for some reason we can't answer it today, we will of course come back to you as quickly as possible with an answer. But hopefully we'll be able to answer most things today. Over to you all, please. Can you either ask it in chat or hands up if anybody's got a question? Go on, someone go. Oh dear. We overwhelmed everyone. I don't think anyone's got a question to ask by the looks of things. Please come in, sir. You can see. Oh, hang on. Oh, thanks, Marion.
Not seeing any hands up.
Not seeing any hands up. Okay. Well, usually the hands up go at the top, don't they? Okay. In that case, if nobody's got any questions, please feel free to submit questions to the Trust at a future date if you want to, following this. Equally, feel free to look up the annual reports, the annual financial report and the minutes from last year via the website, which is all available, and the details were in one of the slides, and presumably they'll be shared, will they? After this, that's brilliant. Thank you very much. So I think that's about it. That's the end of business for today. That's our AGM completed. I do hope you found it informative. I'm still sort of reeling from the amount of amazing stuff that has been described to you all this morning, because I genuinely think this is an amazing trust. Likewise, I congratulate and thank our staff because they are incredible. They've done so much in the past 2 years, but obviously today we're talking about the past year. And I'll thank those of you who have attended for attending. Hope we'll see you soon. Thank you very much, everybody.